I'm Dr. Maha Hussain. I'm a professor of medicine in the Division of Hematology Oncology, and I'm the Deputy Director of the Lurie Cancer Center of Northwestern Medicine and Northwestern University. We completed and presented at the ESMO meeting in Barcelona the exciting results from an exciting trial. The trial evaluated the role of olaparib, which is a PARP inhibitor, in men who have tumors that have DNA repair defects. The trial design was based on pre-selecting the population of patients who had DNA repair defects. Depending on the nature of the defects, the patients were put in two separate cohorts. Those whose tumors had BRCA1, 2, or ATM were in cohort 1 or A, and any other alteration that were felt to be DNA repair defect related were in cohort B. In both cohorts, men were randomized 2-to-1 for olaparib versus standard of care oral hormone therapy or AR targeted therapy based on physician choice of either abiraterone prednisone or enzalutamide. And then at time of progression, then the patients were allowed to cross over, who were on the control arm, they were allowed to cross over to active olaparib therapy. Somewhere about 80%, in fact, of the patients crossed over to olaparib therapy. Now, the testing, I should say, of the tissue was done centrally. And the primary endpoint for the study was radiographic progression-free survival, which was done again by blinded central independent reviewer. At the end of the day, the patients in both cohorts appeared to do better with the olaparib, and primarily for the primary cohort, there was doubling of the progression-free survival in favor of the olaparib. There was actually improvement in the rate of measurable disease response, overall progression-free survival, the therapeutic efficacy of the olaparib treatment. And while the survival data is not yet mature, we anticipate sometime in 2020 that we will be able to report the survival data. The trends are quite favorable in favor of the olaparib treatment. These observations were again for the primary cohort and for the cohort overall. Overall, the treatment was well tolerated, and the type of side effects we're seeing are pretty much consistent with what we expect with the drug itself and in this kind of very heavily pre-treated population. This trial was not done in frontline resistant situation. It was done in patients who have progressed on frontline therapy for castration-resistant disease, and as it turns out, the population was quite heavily pre-treated. Over 60% have seen chemotherapy. Many of them have seen both abiraterone and enzalutamide previously, so fairly heavily pre-treated patient population. So to see that kind of trend on progression-free survival is very, very exciting, actually. One of the other exciting things about this trial is that prostate cancer has really lagged behind other tumors with regard to targeted therapy and precision medicine, and in part because the androgen receptor has been a very dominant pathway in the biology and in the management of this disease. What is exciting now is that this trial actually demonstrates the potential for and the feasibility actually of doing precision medicine targeted therapy and hopefully leading to drug approval in patients with prostate cancer.